Hey everybody, welcome to Bridge Day. My name is Derek. I am a third year PsyD student and going to my fourth year. And I'm going to be giving a presentation today on what program is right for you. All right. Okay. So, yeah, like I said before, what program is right for me? And here, I hope after this presentation, you guys can have a bit more of a information, at least, to be able to make an informed decision about what kind of programs you're looking for, what sort of things you would like to be doing once you do graduate, and ultimately what kind of career path you'd like to pursue. So for me, like I said, I'm a third year PsyD student. Um, I chose a clinical psychology program because I always knew since I was probably midway through high school that I wanted to be a therapist. I kind of enjoy figuring people out, but also helping them. So it's kind of like putting the two together for me just made a lot of sense. So currently, what you'll find is that practice is a big part of any clinical training program. So I'm actually at a extern site where I take part in forensic evaluations. I do regular psychotherapy and clinical intervention, as well as do regular psychological assessment work. So my current research interest, I'm working on my dissertation. My dissertation is heavily involving biopsychology and the parasympathetic nervous system and how that correlates with the generation of therapeutic alliance quality between a therapist and a client in a psychotherapy relationship. So how did I make the choice? Like I said, I've kind of always wanted to do it, but what drove me to a PsyD program in particular was the fact that there's a heavy emphasis on clinical training almost from the get-go. For me, I didn't really want to do a heavy dose of research as my primary um, field of interest. I really just wanted to get the practice to be a good therapist once I'm done with my degree. So the first thing you kind of have to ask yourself is what is your end goal, right? Setting a goal is a very important thing to do, essentially when you're looking for programs that you would like to pursue. So like I said, my goal was to be a practitioner once I'm done. Once I'm over and done with my degree, I'd like to be out in the world helping people more days than not. So that's why I made my choice. But ask yourself the question. I would encourage you guys to, maybe jot a note down or two, or just thought that you get from this presentation, just to keep your own thoughts organized. What kind of field do you want to even be in? Is it a field where you're seeing people one on one? Is it where you're working in a group context, or maybe you're working with a range of individuals and seeing, I don't know, many people a day, or a group of people per day, sort of in a residential facility? Kind of get your mindset on what sort of work you could see yourself doing or have interest in doing, or maybe you've already been doing, but would like to capitalize on that skill set a bit more. Um, so what kind of professional activities would you like to be responsible for? What kind of skill sets would you like people to be able to come to you for as well? So like I said before, anything that falls under the umbrella of clinical work, therapy, psychological assessment, consultation, case management even, obviously, and then supervising other individuals who are providing services. Research work can be anything from teaching classes, or excuse me, a research field, anything where you're teaching the next generation of researchers or teaching the next generation of clinicians. Also conducting your own interest in your own field of interest, whatever that may be. Um, Getting to publish those results and actively share and contribute to the scientific community at large, and also adding to the field's knowledge through things like conferences, networking, and general correspondence that would make for good relationships with the scientific community. Other professional endeavors, obviously, it's not limited to just the things I have listed here. So, kind of thinking more broadly and creatively, public outreach programs, really even establishing programs yourself, which requires, of course, a lot of funding and a lot of work on the front end to really get some sort of plan up and running, but it can be really have a really large payoff as well. Um, and things like program evaluation, programs that already exist, are they working? Are they worth keeping around? Are they doing the purpose that's intended for them? So really keeping um, that skill set available to yourself as well. And again, like I said, by no means was that an exhaustive list of things any of you might want to be doing, but just things to keep in mind. So what type of programs are we talking about here? So like I said, you all are maybe coming in from different majors, different disciplines, or different areas or fields of interest that you've been exposed to or are currently working in or working for. Um, like I said, my background, I got my undergraduate in psychology. I got my master's in psychology, and now I'm, pursuing a PsyD in clinical psychology. So I was pretty much psychology the whole way through. But what type of program would cater best to what your end goal is or what you're envisioning as we went through that slide? So PhD programs, a large research emphasis. They're, you know, the historic doctorate without being a medical doctor would be the PhD program. There are many PhD programs, not just for psychology, but for psychology. There's also school psychology PhDs. There's just general psychology, experimental, developmental, clinical, kind of any area of psychology you've heard or ever been exposed to, there's a PhD for it. You just got to have to do the back end research to look at where they are or where they're available. If it is a clinical training program, they typically follow a scholar practitioner model, which basically means you're doing more of the research focus versus the intervention focus. So you're learning clinical skills and you're learning interventions, but how does that apply to using these skill sets within a research setting, right? Being high fidelity, which just means you're really sticking to the book when it comes to implementation, but also who can you use this for? How can it be integrated into research? How can it be administered in a standardized way? But that's not always true, but generally speaking, that's how those training programs can go. PhD programs are more funded. That's just kind of a period mark. They're established usually. A lot of um, older universities that have been around for a long time that have PhD programs typically are not just well funded. Sometimes they are completely tuition free if you're able to get into them. These are some of like the UPenns, the Drexels, right? These are the big names when you think of elite universities that offer obviously a well-rounded, very high-level education, of course. But again, they're very competitive as well. So making sure the resume, the CV, the experiences that you've had up to date would cover an application of that, and so that you're not wasting your time. And just for tons of purposes, PsyD and PhD programs, the average amount of time you have to complete them is, or that they can be completed, is around 5 to 7 years. I don't know any that are 4 years, but typically 5 is the lower end. Westchester's is 5. The longest would be 7. That's usually just because of some universities or colleges mandate that you do 3 years of practicum, which is just 3 clinical training years in addition to your last year internship, which is your full 40 hours a week clinical training. You're basically doing the job of a psychologist, but you're right. You're not quite there yet. You don't have the degree. So moving on to the PsyD itself, still very similar, 5 to 7 years with a larger emphasis on clinical training itself. So not to say that there is a difference between a clinical PhD and a PsyD or clinical PsyD, excuse me, but really it is this practitioner scholar model instead of this scholar practitioner model. So how is the intervention you're learning going to best apply to the people you're seeing and for the people that you know? Right. So it's sort of like take in the research, absorb it, and then use it for and adapt it to the people that you're going to be seeing. Whereas this scholar practitioner research focused model may be more, let's implement this the same way each time. And then theoretically, this should work because the research shows really good results. Now, this is not cut and dry. Not all PhD doctorates, not all PsyD doctorates follow that. There's a lot of in between, but for the most part, this is how the training programs may or may not be set up. So that's some of that culture possibly could be absorbed into the clinical work itself. Masters of Social Work. Social work is its own school of thought, independent from psychology. There's a lot of overlap. There's discrepancies. There's different theories. And a lot of the work that both fields do overlaps quite a bit, and one can complement the other. But again, it just depends what your interests are. Masters of Social Work are typically 1.5 to 2.5 years, the typical length for a master's program. MAs and MSs in clinical psychology and counseling, same thing. Master's degrees are just a lot shorter than doctoral degrees, because doctoral degrees, there's maybe not more coursework, so to speak, but there's a lot more emphasis or in-depth training that goes into it, a lot more time spent in the training itself. And then just as an aside, I know this is about non-medical related, but also related anyway. I just added it in here anyway. If anyone's interested in being a psychiatrist, I just threw it in there because I know it's still relevant. People don't always know this, but to be a psychiatrist, you first have to become a medical doctor, which medical school is anywhere from 3 to 4 years. But then on top of that, you have to specialize in a discipline, which is a 3-year residency. So you're looking at 7 years to be specialized in psychiatry. But then I think it's another 3 years of active practice or something to that effect, where you then can get licensed as an independent psychiatric practitioner. So that's the timeline you'd be looking at here. But for the rest of this presentation, I won't really go into that because it's more on the medical end of things. So all different programs have different implications for what all of this even means. So PhD offers ongoing research projects, including the dissertation, which is just a cumulative research project showing that the time you were in graduate school, you absorbed something, you caught an idea that caught your interest, and you made a project about it. You were able to actually collect data, test hypotheses, and analyze it to speak to the results that you hopefully wanted to see or did not see, and why that is. The opportunities for clinical training, especially in clinical PhD programs, they're there, but also throughout, it trains you and sets you up for duties related to being a clinical or to being a psychologist once you are all said and done with your degree, which it's vast. It's not just therapy, it's not just assessment, it's not just research, it's quite a number of things. Research experience will set it up nicely for being an academic professional as well. So here's where the PhD scholar practitioner research emphasis comes into play. Many professors that you've had, PhD, just a lot of more of a research academician perspective and focus with these degrees. And then people tend to move on to, potentially, not always, this sort of setting or gravitate towards this setting. If you would be in a PhD program, that's kind of where you want to go or want to be, it would be an easier transition because you've already been exposed to and trained within that model. So it would be a much smoother transition. But like I said before about funding, these programs are typically more competitive because there is funding available. There are a limited number of spots, as with any program, but especially with PhD programs, you may have the lowest end I've seen is 5 people in a cohort total. The highest is maybe 16 or 17 individuals per year. So you may have 600 applicants or more every year, and then only 17 at max actually get in for a specific year. So there's a lot of competition there, a lot. So PsyDs, similar, 5 to 7 years, but different, of course. Clinical work is at the forefront of the education. You may have an ongoing research project depending on the program that you chose. So within Westchester's PsyD program, we do have an emphasis on research training as well. And we do have a dissertation that we have to complete by the time we want our degree to be conferred, okay, at the end of our 5 years and at the end of our internship. These programs are designed to train psychologists, again, to be practicing professionals in psychology after the degree is done, similar to PhD. There is a larger emphasis on the clinical process of professional psychology. So how are you going to learn this in school through your practicum sites and then take this into the world and then do it and then use it and then be successful in doing it? So it may be that with a PhD program, you're learning all very similar things, but it's more so, how do you consider this when you're doing your research? How do you consider this when you're implementing a intervention in a new setting where something is novel or unique, and you have to account for that in your research grant writing, in your analysis of results, your discussion of results, right? This is more so about how to be active and fluid and adaptable when those differences come up in whatever setting it is that you're working in. And that's not to say that PsyDs can't do research. It's not to say PhDs cannot do clinical work as well as PsyDs. That's not true at all. It's shaped by your experiences and generally what your interests are. These are just the ways the programs are set up so that if you have a specific interest in heavier clinical work or heavier research, that might fit better for you either way. Now, PsyDs are actually sort of more of a novelty when it comes to advanced degrees. PhD, like I said, has been around forever, but PsyDs are relatively new. And don't quote me on exactly when the first PsyD program started. I don't know, but it is relatively novel. A lot of older practitioners in the field right now are PhD. Um, um, they possess a PhD, but a lot of newer clinicians you'll see out in the community actually do have PsyDs. But that's not a hard and fast rule. It's just something I've noticed over time. Less funding is available typically. PsyDs are sort of more elective programs, but that's not the right word to use for it. PhDs have a lot of history behind them, a lot of funding because they actively turn out research, typically, which makes universities look good. So they allocate a lot of funding to these programs. PsyDs aren't producing as much research. They're producing competent practitioners, but not as much research. So therefore, they're not doing as much to give back to the university necessarily, so they don't get as much funding. Again, not a hard and fast rule. This is just based off of my own experience and observations. But with that comes the fact that when considering a PsyD program, you have to take into account the finances. Can you financially even do this? Have you maxed out your student loans? If you're planning to pay for it yourself, do you have the resources and capital? Do you have the support system to be able to take on a 5-year full-time program to be able to finish? It's really just, it comes down to the longevity of what you're prepared to do and sacrifice. More recognizable degree, like I just touched on, it is more prevalent in the community now. Not saying that it hasn't been in the last couple of decades, but again, just something I've noticed. So what are the differences? So most notably, if I haven't already touched on it before, the differences in style of education. Research PhD, clinical emphasis with PsyD, not a hard and fast rule, but generally speaking, that's what it is. Doctoral degrees afford doctorate level work. So once you are officially done with a doctoral degree in psychology, PhD or PsyD, you can call yourself a psychologist, or you can call yourself Dr. whomever. Okay. There are differences in what jobs you actually can get. Experience matters. So this goes back to what I said about not all PhDs are not clinicians, not all PsyDs are non-researchers. It depends on the experience you've accumulated. If I, in my PsyD program, decided with my research mentor that I would like to pursue one research project a year for the time that I'm in the program, um, we could have done that. We could have worked that plan out. So that would set me up really nicely to be able to have a research-driven career once I'm done with my doctoral degree. Whereas in PhD programs, that more or less may be expected. And subsequently, same thing with PhD. If you want to go for a lot more clinical training, there may or may not be opportunities for that. But experience really shapes what you're able to do. And I'll get more on this later. During the training program, the experiences you like to engage in can shape the career path. So this is true. If you're sitting here right now thinking, I want to do all research, I want to be a competent researcher, clinical intervention research with schools. Um, that's great. You want to expose yourself to school-based intervention, probably some community intervention, child and adolescent. You want to make sure that child and adolescent work is actually available through that program, that degree, just to kind of get exposure to that. It'd be like saying, I want to be an astronaut, but have no background in engineering or physics, right? You kind of need the experience to shape what the end goal is. Some examples of this, if you want to do so, right, if you have an interest or would like to do personality assessments, right? So looking at the dimensions of a person's psychological makeup that constitute how they interact with the world, right? If you have an interest in that and with a clinical spin on it, how does that go wrong, or what does that look like when it goes wrong for an individual person? Right, you could reasonably say if you get exposure to a lot of these assessments or a lot of this experience during your graduate degree, you may set yourself up really nicely for being a forensic consultant for evaluations in legal cases. So part of what I do right now is doing this, right? It's taking on somebody who has experienced something, and for better or worse, they now have a pending legal case, and we have to be able to evaluate them and say after incident one, these are the psychological sequelae of that particular incident. Here's what it means for this person now compared to where they were before. Training clinical interventions related to anxiety and stress disorders. So this is just like if you're interested in trauma, right, and you expose yourself to practicum sites that do a lot of work with this. You would set yourself up really nice to be, once you're done with your degree, a VA staff psychologist who actively sees veterans and active duty service members. So those with different degrees, they work in different settings for the most part. Again, not a hard and fast rule. And the reason I keep bringing back this not hard and fast rule with exceptions is that a doctoral degree offers you a wide range of opportunity. There's a large amount of things you can get into, and I couldn't name them all here. That's not the purpose of this presentation, in particular, but some things I've already mentioned, right? Therapy, assessment, consultation, being a supervisor, teaching classes, being a researcher, evaluating programs in the community outreach. Really, the the possibilities not are endless, but they're very expansive. There's a lot of different things you could be doing. So a doctoral degree is very flexible, but typically, depending on the experience you've had in that program, what type of program it is, you may end up in a specific type of or genre of setting, so to speak. So PhD, research-oriented positions, they can be professors, independent researchers. Um, Settings include college and universities, governmental facilities, clinical research settings, so things like teaching hospitals, research hospitals, where there's ongoing active collaboration with the departments of psychiatry or neurology, things like that. Government facilities, so any facility or governmental body that cares about mental health, they're going to need practitioners, researchers that are able to aggregate and do data collection. so that they can, produce valid results and can be a helpful crux for society, of course, and then help everybody else when they need to go look those things up as well. PsyD, clinical practitioner primarily, psychotherapists, evaluators, consultants, supervisors. There's some overlap here. Typically, they can be in private practice, community health settings, primary care offices, and school psychologists. Not to say this is, again, hard and fast rule. There are PhDs that are school psychologists. There are PsyDs that are professors and clinical researchers. There are PhDs that are in private practice and start their own private practice. So very flexible degree. The earnings potential itself. So, and I didn't get to MSW and MS yet, but that'll be in the following slides. But just as a brief snapshot and getting maybe to what questions you guys have about what does this pay? What does this look like? Because 5 years is a lot of school. It's expensive graduate school. How am I going to pay this back? So earnings potential. This is just some brief metrics from study.com. I encourage you to, just do your own research, Google search, belabor it, because again, this is entirely your choice. But PhD, general clinical school, 88K, roughly around 86 on average. That's just, what came up. PsyDs, general, and that's just expansive, like kind of whatever duties and responsibilities are doing. Clinical, right, outpatient assessment, forensic psychologist in the school. Average looks about 77 or 76. Okay, so about 10K less on average than PhDs. Now, that on paper may look very discrepant. I didn't really do a research project on this, but if I had to guess, it would be because there's more older or more established PhD practitioners out in the world or in the country who have been around longer, therefore their rates are higher, they get paid more versus younger, newer PsyDs who aren't really well established yet, get paid less or their rates are less. And so that gap you're seeing there is reflective of just the sheer number of, comparatively speaking, of PhD to PsyDs. And again, this is just a quick internet search. Go ahead and do your own research. MSW, similar. So unspecified, we're just kind of generic category: healthcare, child and family, mental health, and substance abuse. So those numbers correspond exactly. It looks like the most is, I don't know, the average one, healthcare being next, and then family and school, and then mental health is about the same. For an MA or an MS in clinical psychology or counseling, it appears to be 50K as average. Now, for the master's programs I'm going to talk about here, just know that the master's degree is much shorter, less time intensive, typically only has one internship attached to it instead of a couple bouts of practicum experience and then an internship. So that's where the extra training from doctoral degrees versus master's degrees comes into effect. Okay. All right. So the Master of Social Work, the emphasis in social work discipline, not being a social worker, but on environmental interactions with the individuals they work with. So they look at the person, the family, the community, the country, the government, the society, the culture. Not that psychologists don't do this as well, but this is more of the theme of social work versus psychology, where it's more about the person, the individual. So education encompasses an interest in the system's effect on the individuals for the purposes of connection with resources, counseling and therapy, community interventions, and legality, of course. They can obtain opportunities to practice therapy and become licensed. So the other thing I didn't speak to yet was about licensure. To be an independent practitioner that does not have to be supervised to do clinical service, you have to be licensed. What that means is you accrue a certain amount of hours. It's different for each program, so I'm not going to get into that right now. But you accrue a certain amount of hours. You sign up to take this test. For licensed psychologists, it's called the EPPP. You can look it up if you want. And that happens after you get your degree. As of right now, you have to accrue 1,750 service hours before you get your degree. For master's degrees programs, I'm not exactly sure. To be a licensed practicing clinician and LPC, I think it's about 2,000 hours after you get your master's degree. So you have to get your master's degree, work, and have 2,000 direct service hours with clients and supervised, and then you're able to sit for the exam and get your license. So, yeah, those are the opportunities for clinical work. It's a versatile degree. There's many different settings social workers come to play: community centers, clinics, hospitals, courts, therapy offices. Kind of another very flexible degree on where you want to work. Masters in counseling and clinical psychology. So these training programs are designed to help students, set up students to be good practitioners in psychotherapy. Okay. So there's not the range of experiences that a doctoral level psychology program would afford you. But this is really, if you just want to do therapy and that's all you're interested in, you've only ever been interested in that, this may be the program for you. So shorter term, 1.5, 2.5 years compared to 5 to 7. Similar to the Master's of Social Work, you're eligible for licensure after that time gap. There is nuance to what therapy can be, though. So there's still a long list of job opportunities for someone with an MS or an MA through continuing education credits. So continuing eds are something that every practitioner with a license needs to stay licensed. So the education never stops, unfortunately, once you're done with your degree. I want to say for licensed psychologists, you need 30 hours. That might be wrong. 30 hours of continuing education experiences. So basically these workshops that you pay to attend, or if it's through your agency, are free to attend, which would be nice. But essentially you have to do that 30 hours every 2 years to maintain your license. For LPCs, I'm not exactly sure what it is. But therapy can be a lot of different things. It can be individual, it can be group therapy, it can be a consultation role with an MA or MS. It can be ABA therapy if you're more into the autism and developmental disorders world. Yeah. So what type of experience do you want? Sorry, I just want to jump ahead here and make sure. Okay. So what type of experience do you want? That's up to you guys. Really, I hope this presentation gets you thinking just a little bit more about this question in particular. If you want a generalizable, very flexible degree that offers you kind of a range of things, if you feel like you don't want to stay in one thing for too long, PhD or PsyD. You can, be an independent practitioner, do assessments, do evaluations, and if you want to get into something else later down the road, take a certification program, and you can become a forensic consultant because you already have the doctoral degree. So there's a lot of things you can do with these degrees. So very, very generalizable. Yeah, I kind of touched on everything else. Professional certification. So, anytime you've seen somebody with PhD or PsyD or, master's after they name the actual degree, sometimes they have commas and they have more letters. Those are typically professional certifications. So, certified forensic consultant would be CFC. There's a ton out there. I could never name them all. But if you want a degree where you're primarily working with the community at large, you're enacting change at the individual, and the community level or the systemic level, Masters of Social Work may be more your speed. Many things can be accomplished through social work. Therapy is just one part of the domain. Okay, that's just one part of what you can be doing. Social workers also develop their own path post-degree. So, there are social workers who are researchers. There are social workers who are, internationally recognized clinicians. There are social workers who just have an overabundance of legal cases that they actively consult on and are part of. It's kind of it's another expansive degree. Um, yeah, so if that kind of interests you, I would, again, research these programs before you get into it. A degree, we're primarily working with individuals in some sort of therapeutic endeavor, whether that's individual therapy, group therapy, other types of therapy, other modalities. This is the quickest way to become a therapist, with the exception of MSW, with one exception being substance abuse counselors. Sometimes, for whatever reason, you can be a substance use counselor with just a bachelor's degree. I don't think it's that common. I'm pretty sure a master's degree is preferred anyway, but it's out there. I've seen it. Um, you can also develop a specialization, just similar to every other degree I've talked about here. Uh, they are, however, limited to the continuing ed opportunities and the formal training that you may be willing to go through after you're done. So if you're thinking, I'm an individual therapist, I've got my license, but I'm just missing some part of what I want to be doing. Continuing heads are great, but more formal, transcript, worthy training may be necessary in order to be able to pursue that. So this is true of MAMS and also probably MSW. Um, uh, you just might have to go back for another type of program or another type of formalized educational setting. So at the end of the day, it really just depends on what you think that you guys actually want to end up doing. Really, the best advice I can give is take a look within yourself. What do you value as, a professional, as a person, and how do you then translate that into a career goal, an end goal for yourself, what you see yourself doing in 5 or 10 years? And then tailoring everything that was just presented here, of course, which is not exhaustive, right? There's so much more out there. So go ahead and look it up to what you want to be doing. And I know it says questions here, but I know this is not a live feed, so I apologize for that. But I believe there is a Q&A period. And yeah, all right, guys. Hope you enjoyed the presentation. Hope it was somewhat educational and informational. I should have left up my email here for any questions and comments, but I'll be able to provide that on Bridge Day itself in case you all want to reach out to me. Okay. All right. Good luck with the rest of your time. Thanks. Bye.